I'd just like to say a little bit now about breastfeeding. So breastfeeding is a hotly emotional topic for many women. So we are constantly told that breast is best, and you know it is. And if you can breastfeed easily, then that is great. That is really fantastic. If you are struggling to breastfeed, I think many women who come to see me can feel like they have failed. It's a really emotional, it really hits them hard, basically. So you know, the best advice is, you know, obviously to persevere, but you know, there are many great lactation consultants now that can actually come and see you in your home. You can also get free advice from many breastfeeding drop-in centres. You can also ring up lactation helplines like the La Leche League. I remember ringing them in tears with my first baby, and they were really supportive on the phone. So most commonly in the clinic, people will come to see me because they are suffering from mastitis, which is where the breast becomes swollen and painful, and sometimes this can lead to infection. If it's got to the infection stage, then you know you do kind of need antibiotics really to clear it up. So it can be really painful, hot, burning, sort of swollen, engorged breasts. So to sort of prevent mastitis, it's really good to make sure that your baby has completely emptied the boob, and you need to keep trying to feed them on it, however painful it is, because quite often they can unlock the blockage. You can also try warm flannels, you can try breast massage, and actually in Japan I believe they use breast comb, so just a normal hair comb that like a granddad would use. You actually comb the breast before you feed the baby, and this helps to move the blockage forward. Gentle combing, obviously, just very gentle, just to help move that blockage forwards. Quite often you can feel it, you can actually feel that there's a blockage there, so it just kind of really just helps to sort of move it. And if you can get it early enough, then baby can actually help you unblock it. So that's a really good tip. Acupuncture is great for mastitis. It's also good for encouraging milk supply. One of the best things you can do for milk supply is placenta encapsulation, which really boosts your milk supply. But if you haven't encapsulated your placenta, then you really need to think about blood nourishing foods, which is something that your acupuncturist will discuss with you in more detail, what sort of foods you should be eating. Can also you know, there are things you can take like fennel tea, mother's milk, and all of these sort of natural remedies. Actually, one of the best ones is to have half a pint of Guinness every day. That is actually one of the best things that you can do to increase your milk supply. And also I get asked quite a lot about expressing milk. So this is something some people find really difficult. I know that I struggled quite a lot with my first baby to express. So through trial and error, what I found the best method to do was always do it at the same time each day, always use the same boob at the same time. And I used to get my baby to actually latch on the other boob, and I used to express on the other boob while they were feeding, because the babies are the experts at breastfeeding, and actually they would get the letdown, and then I would be able to express more easily using an electric pump. So I tried hand pumps, they never worked for me. I found the whole thing very depressing, and I was also quite worried, is this all my baby's getting? But actually that's not reflective. Some people are just really good at pumping, and some people like me struggle to pump. So if you do it at the same time every day, I was normally doing it in the morning, so around 9 o'clock, feed the baby on one side and express on the other, and then just pop that milk in the freezer, and it's good there for 3 months. So I hope that's helpful. But acupuncture can be really helpful for any breastfeeding problems, and the emotional impact that it has as well.